Actually, as we talked through this whole series, different things started coming to our mind, and one of them is what can stall or even kill a transaction, right, whether it's the buyer or the seller side of it. And the first thing we both said was communication. I'm going to let you elaborate on that here in a second, but communication, we do believe, is probably the key to setting the right expectation and make sure your transactions go through correctly. So why don't you give us a little insight to that?
Yeah, I think communication is something that could not only derail a deal, but it could actually end a deal. And we talk about communication. Communication is important. You want to have someone be in constant contact, maybe even have one of your team members, one of your professionals, your lawyer, your lender, whoever it is, be the point person to communicate with everybody. But more importantly than that, as a client, you want to make sure that your professionals that you're dealing with have a good understanding and can comprehend actually what it is that you're asking for, what it is that you want. So when you talk to them, make sure they're kind of throwing it back at you, right? So if they say a term and you use a term that is popular in the lending world, or I use a term that lawyers use, I don't expect, or I shouldn't expect that a dentist understands, and same way back and forth. I don't understand everything that the dentist is saying to me as far as language goes.
It's funny you bring that up when people talk with you. I have a terrible habit of always saying, "Does that make sense?" at the end of some of my questions, right, or the conversation we're having. But the clarity that comes from that when you're dealing with somebody is ultimately what we're all looking for.
Right. And
as a doctor, at the end of that, and you're trying to work with your attorney, your CPA, talking in the vernacular, right, that they're used to, right, is huge. But if you don't have that vernacular, then trying to explain it appropriately and making sure they do comprehend it, and that they have what you were trying to explain in your best interest, right, being presented to the other side of it.
Right. Yeah, and that's important too, because if they understand, or if they don't understand what you want or what's important to you, and now they're going to talk to the seller's broker or attorney or a landlord, you want to make sure that what you think is actually going to happen is getting communicated in a good and clear way. And that brings me kind of to another point of where communication can be an issue. Is you've got professionals who maybe intentionally or unintentionally want to derail a deal, or just it so happens, whether that's communication, whether that's they've got their own sort of idea of what it should look like, or they want to play hardball, or they just don't know what they're doing. And that goes back to really understanding and evaluating the professionals that you work with.
I'll give you a good example. Like sometimes I think seeing it in an example is a good way of explaining it. I had a client, and this was many years ago, it was almost 8-9 years ago, when they were negotiating the sales contract. The buyer had, it was like 17 or 18 points they negotiated on the sales contract. Mm-hmm. One of them being the purchase price, obviously, and then a bunch of other pieces to it. Well, the seller came back and said yes to everything except for the purchase price change. And in that situation, the buyer actually was offended that they didn't negotiate the purchase price. Mm-hmm. Kudos to the practice broker that was involved and the attorneys involved. They had to take it aside and say, hey, I understand the culture behind here and what's going on. That person said yes to 16 out of your 17 changes, but not on the purchase price, because this has allowed them to get to their retirement number. Right. And so if they didn't take that extra step and communicate what was actually happening there, that transaction would have been dead on arrival.
Yep.
Right. And in that situation, they went through, everybody had a great time. It ended up closing, and the doctor was happy. But the key to that was really taking that extra step and communicating what both sides were trying to do there.
Right. Yeah, I think that's an excellent point. On that same sort of topic of what can maybe blow up a deal, derail it, what are some things that you've seen from a lender side that maybe impact a deal?
Yeah, again with the story time. So if we take one step back and say, hey, having a dental specific professional helping you, this is a great example as to why that's important. Many times you start looking at, people always talk about accounts receivables, mm-hmm. right? Huge part of the transaction, most of the time they're not being purchased, but it's always a talking point. One of the areas that does get forgotten about if you're not working with the dental specific professional is going to be your patient credits.
Right.
And I've seen that many times blow up a transaction, whether the seller just didn't have clean books and records where that was actually cleaned up, or there really was a large patient credit that was owed to patients.
Right.
Either which way, you don't want that happening on the 1 yard line. Right. You want that happening early on, so there's plenty of time to work through it, and both parties are able to be comfortable with the outcome of that.
Right.
So patient credits was a big one. The other one that we talked about was really the expectations of it.
Right.
Early on, if you're buying, the best example I can give you is a doctor is an associate that's working for a doctor that's going to now want to sell to them.
Mm-hmm.
The most common conversation you have in this is the buying doctor is saying, I should be able to buy the practice at a large discount because I was the associate for the practice. Right? You've seen it a million times.
Oh, yeah.
So when that happens, the real conversation that happens, or the communication, the understanding that needs to happen is, that seller did pay you an appropriate wage for you to accomplish your job, right? And if they were selling to somebody else, they would still get an appropriate value based upon your work being done there. Right? Not minus your work being done there. So it is one of those ones where the expectations sometimes can not align to reality.
Right.
But if you have good professionals working with you, and most importantly, the lines of communication between Dr. Buyer and Dr. Seller are open.
Right.
People should be able to have that conversation and still get to a happy medium there.
Absolutely. Yeah, I think a lot of it comes back to the communication and comprehension, and having those professionals being able to do that effectively, and that helps keep a deal on track and get to closing.